Good morning to those that are just waking up. Good afternoon or good evening. I'm not sure what time you're listening to this, but today we're going to talk about scalding and burn prevention training for healthcare workers. So the purpose of this training is to educate healthcare workers on scald and burn prevention to ensure patient safety, especially for high-risk populations like infants, elderly, and individuals with disabilities. The objectives are to understand common causes of burns and scald injuries in healthcare settings, implement preventative measures in clinical and home care environments, and recognize early signs of burns and provide appropriate first aid. So understanding the difference between scalds and burns, they kind of go hand in hand, but we can kind of distinguish the difference. So a burn is an injury caused by heat, chemicals, electricity, radiation, or friction. Scald is when you burn yourself specifically with like hot liquids or steam. And there are a few types of burns that we're going to talk about, and that's thermal burn, chemical burn, electrical burn, and radiation. Thermal burns is when you come into contact with flames, hot objects, steam, or hot liquids. Chemical burns are exposure to strong acids or some type of chemical. Electrical burns, you come in contact with electrical currents. Radiation burns are from excessive sun exposure or radiation therapy. Now, there are a few different classes of burns, and it's classified by the severity of the burn. So the first one is, of course, first degree burn. There's second degree burn and third degree burn. So if you can see the picture here, that I included will show the different layers of the skin that correspond to that degree of the burn. So the first degree burn is when it affects only the epidermis, which is the top layer of the skin. And this is like sunburns, like mild scald, things like that. Second degree burn affects both the epidermis and the dermis, so that first layer of skin as well as the dermis underneath. So this is when you get a little burn and you get the blisters. Example would be like from hot water or something. Third degree burns extend through all skin layers and possibly affecting like muscles and bones. These are a couple of pictures, probably the best pictures that I could find with the different degree of burns. You can see in the first picture where it affects that top layer of the skin, and then the second picture over to the blisters, and then of course the third degree burn, which is the third image. So I always like to give some statistics to kind of give us a broader picture of how severe this is. So annually, over 450,000 burn injuries require medical treatment in the U.S. Scald burns account for 33% of all burn center admissions. Young children account for 40% of all scald burns. More than 73% of burn injuries occur in the home. The older adults, and this is like 65 plus, account for 25 to 30% of hospital admissions for burns. Some of those common causes are bathing injuries, kitchen burns, heating devices. So let's talk about some of the risk factors. Now this is high risk populations in infants and young children, elderly patients. They tend to have thinner skin, they have decreased sensation. Individuals well, individuals with mobility impairments or neuropathy, so they're already experiencing some type of pain already. Patients with cognitive impairments, such as people with dementia. Bathing and showering assistance. Hot food and beverages in patient care areas. Heating devices like heating pads. We all know the elderly population especially love to use heating pads. Electrical blankets. Oxygen therapy. There's a risk of combustion near flames. Surgical or wound procedures involving cautery or chemicals. So we're going to go over some prevention. So we've learned the different types of burns, some examples. Now, how do we prevent them? What are some strategies that we can use to prevent them? Well, the first one, temperature control. You want to make sure you set heaters and water heaters to equal or less than 120 to prevent scalding. Make sure you test the water temperature. Safe handling of hot liquids with food. Use of lids on hot beverages near patients. Make sure you're properly cooling their meals. Safe use of heating devices. You want to avoid skin-to-skin contact with heating pads. You should never put it directly on your skin. Hot water and electrical blankets. Oxygen safety devices like oxygen tanks. So you want to keep the oxygen tanks away from open flames or high sources of heat. This is something that we have to make sure we pay attention to, especially with those patients that still smoke. They cannot smoke around their oxygen tanks, and we do have some people that still will try their luck at that, but that is very dangerous. Patient and staff education. We want to make sure we're trained on burn prevention measures and educate the family members on safe temperatures. Some emergency response and burn first aid. So the first aid for minor burns, make sure you cool the burn. So if you're burning something minor, you're going to cool the burn with lukewarm water. Yes, I did not say immediately with cold water. Lukewarm water for 10 to 20 minutes. Do not apply ice, butter, or ointments immediately. So normally when we get burned or something, especially if it's something that's very, very minor, like let's say the tip of our finger, a lot of people have a habit of immediately going to their mouth with it or putting some butter or ice on it. That's not always a good thing. You do not want to apply ice, butter, or ointments immediately. You want to make sure you cover it with the sterile, non-adhesive dressing. So I know you're probably thinking, well, we're out in the open, we're in the public, I'm at home, I don't have anything sterile. Make sure it's clean. Make sure it's something clean that you're putting on it. Non-adhesive means you don't want to put nothing that's going to stick to it. The first aid for severe burns. Do not remove clothing stuck to skin. If you encounter a patient or even with yourself and your clothes is sticking to, or their clothes is sticking to them, please do not attempt to remove that clothing. You can cause more harm than good. Cover the area with a clean, dry cloth. Elevate burned limbs to reduce swelling. You want to seek immediate medical attention. So when do we escalate the care? When the burn is covering more than 10% of the body. Facial, hand, foot, or groin burns, make sure you call for help immediately. Inhalation burns. So if you've been exposed or the patient has been exposed to smoke or steam, like from a fire or something, that requires immediate attention. And if they're experiencing any signs of some type of infection in healing the burns. So let's test your knowledge. A nurse is preparing a bath for an elderly patient and notices the water is steaming. What should be done before proceeding? If you answered test the water temperature and adjust it to less than or equal to 120 degrees, then you are absolutely correct. We have to make sure we are testing the water for our patients and for young children as well. A few examples: there are many different ways that elderly can burn or scald themselves. Remember, they have thinner skin, they have reduced sensation, their mobility is limited, so they have slower reaction time. They can be impaired cognitively, so they can definitely burn themselves, like with the water heater. Sometimes it may be set too high. Stepping into a bath that's too hot. Difficulty adjusting like faucets to control the water. Spilling hot coffee on themselves. They love to drink coffee or tea or eat soups. So just spilling that on their hands or on their laps. Heating their microwave food too high or from steam. They could come into contact with burns like heating pads, electrical blankets, and things like that. Handling old electrical cords. The elderly population, they like to hold on to things. So a reminder, always check water temperature before use. Use safe handling techniques for hot food and liquids. Implement burn prevention strategies in healthcare settings. Be prepared to provide immediate first aid for burns. Make sure you are putting away those things that may be hanging over the edge so that the young children would not be able to access it easily. And last, be sure that things that may be dangerous to the young children and infants are locked away in a cupboard. That's medications, cleaning supplies, electrical appliances, things like that.